Hello and welcome everyone to our latest presentation on the recovery trial, which is on the dexamethasone in hospitalized patients with COVID 19, the preliminary report. The recovery or the randomized evaluation of COVID 19 therapy trial describes an overarching trial design that looks at different treatment options simultaneously in patients with SARS-CoV-2 infection. It's an adaptive design, and the treatments that have been studied are they had divided into three groups, that is group A, which has usual treatment, steroids, lopinavir, ritonavir. This arm of the trial has ceased recruitment as no benefit have been demonstrated. Hydroxychloroquine, again the arm has ceased recruitment with no benefits. Azithromycin. Group B is apart from the group A treatment if you are planning to give convalescent plasma, and group C is tocilizumab. Now let's look at the methods in this particular study. It is unblinded. Patients were randomized in a ratio of 2 is to 1 is to 1 is to 1. That is, usual care got more patients, and the rest treatment groups got 1 is to 1. It's a multicentric trial in the 176 NHS hospitals in the United Kingdom. The inclusion criteria are clinical suspected or proven SARS-CoV-2 infection, age more than 18 years, but this age limit was removed on May 9th. Exclusion are a known indication or contraindication to dexamethasone, and dexamethasone being unavailable in hospital at the time of randomization. Now let's see what intervention was done. 6 milligrams daily dexamethasone for 10 days was given either intravenously or orally. In pregnant and breastfeeding women, prednisolone 40 milligram administered by mouth or IV hydrocortisone 80 milligram twice daily. Now let's see what are the results. Almost 11,000 patients were recruited. Out of this, 6,425 were randomized to either dexamethasone or the standard care. 2,104 were put to the dexamethasone group. 4,321 were recruited in the standard or usual care group. Now coming to the outcomes, the primary outcome was mortality, and in this they found statistically significant benefit of giving dexamethasone. Almost 3% reduction in mortality was noted. Now if we look at the outcome measures, we can see that mortality risk is significantly less in dexamethasone in all participants, that is when we include all 6,425 patients. This benefit is further increased in patients who are on mechanical ventilation. Around 1,007 patients were on invasive mechanical ventilation, and we see a much significantly improved mortality with dexamethasone. But if we look at the impact of dexamethasone patients who are not on oxygen, we find that the dexamethasone increases mortality in patients who are not on oxygen therapy. Now, this is reflected in this forest plot where we see that the patient who are on invasive ventilation and oxygen alone, there is a significant improvement, and more improvement is seen in patients who are on mechanical ventilation. While if the patient is not on oxygen, we see worse outcomes with dexamethasone use. So to summarize our findings, this is a large trial demonstrating significant benefit from administration of dexamethasone to hospitalized COVID-19 patients. And based on this trial, if I do have a patient of COVID 19 pneumonia requiring oxygen and ventilation, I would definitely administer them dexamethasone. Thank you for your patience and check our website for further information.